Grade 10, so we are going to be covering a first aid unit coming up. First aid is how to help those in need if you get certified to do so. So that being said, you are not currently certified just because you take this unit to perform first aid on someone that is in need. You have an understanding, this is to give you basics of first aid, but you are not certified to perform first aid. Okay? Again, this does not count as certification for CPR first aid. So, Good Samaritan laws. What are those? They are laws that are in place to protect you against lawsuits and encourage you to try and assist others in compromised positions. So the following conditions should be met. If you're acting with good intention, you're providing care without expecting compensation, you're acting within the scope of your training, and you are not acting in a negligent manner. So if you're acting in the scope of your training, you are always protected when you're helping someone, even if it doesn't go exactly how you want it to go. If the person ends up not improving with your care, as long as you're acting in the scope of your training, acting with good intentions, providing care without expecting compensation, and you're not being negligent, you'll be good to go. So what does negligent mean? Negligent actions are providing substandard care, withholding care when you are legally required to do so. So for example, a parent legally has to provide care to their child. A teacher legally has to provide care to a student. If you're causing injury or harm, if you're exceeding your level of training, so for you, you're not certified, so you have to be very cautious if you are ever in a situation where there is first aid required, you have no training, so you don't want to ever exceed your level of training. And then if you're ever abandoning the person when you have started treatment, that would be considered negligent as well. So if I started helping someone that had a wound on their arm and I stopped mid-treatment, that would be considered negligent action. So if you are ever first at the scene, there's 5 kind of questions you need to ask yourself. Number 1, is the danger still here? So would going to the injured person or persons put you at risk? For example, there could be down cable lines, there could be fire, there could be water, ice, carbon dioxide. So is going to help that person putting you in a potential compromised and dangerous position? Number 2, you want to ask yourself how many people are hurt. Was there a large accident that injured many people, or is it just one individual isolated incident? 3, you're asking what is the injury? Is this something you know how to help with? So if you've never dealt with back injuries before, it's probably not a good idea for you to go and try and help somebody with a back injury. 4, you have to think of the ABCDE principle, which is airway, breathing, circulation, disability, and expose the injury, which we'll talk about next. And then number 5, who's calling 911 if needed? So not all injuries require 911, but if you are helping the injured person, you should make sure that another bystander calls 911 and stays on the line until emergency medical services arrive, or EMS. If you are the one that is helping the injured person, you want to make sure that it's another individual calling 911. Of course, if you were the only person there, you would do both, but the 911 operator needs a lot of attention while they're trying to get information, and if you're trying to do both things at once, you're either going to have a hard time focusing on caring for the injured person or passing on the correct information to EMS. So A, B, C, D, E, after you've decided that it is safe to help, you need to check for these different things. So A, you need to check for the airway. Is their airway blocked by anything? So are they choking? Is there anything like that going on? B is checking for breathing. Are there signs of breathing? Can you hear someone inhaling and exhaling? Can you see signs of breathing like the chest inflating and then deflating? Circulation, you're checking for external bleeding. So are there any large lacerations? Is there any external wounds where blood will be leaving the body? D stands for disability. Is their mental status or nervous system compromised from the injury that they received? So seeing if they can move their fingers and toes and all their extremities. And then E, exposure of the injury required to assess. So that's saying that would you have to further expose an injury to see what the full scope of the injury was. So if their clothing is covering it, you have to expose that to be able to actually tell what's going on. So if any of the above are apparent, you need to make sure you call EMS right away. These aren't ones that you can fool around with and try and see what you can do on your own before calling 911, you need to call EMS right away with any of these injuries. Protective equipment. So if you're in a first aid situation, you should try and have the following protective gear. You should have gloves, a face mask, eye protection, and access to soap and water / hand sanitizer after you have helped the individual. You may not have access to all of these items, but if you do, you should use them every time you're performing first aid. So our first situation that we're going to look at is anaphylaxis, which is an extreme allergic reaction that is life-threatening. If someone's going into anaphylactic shock, their symptoms would include difficulty breathing, closing of airways, or lack of circulation. So what you should do, number 1, call 911 if someone's going into anaphylactic shock, or ask somebody else, another bystander, to call 911. Step 2, if they have an EpiPen, you need to administer it. So this is an example over here of what an EpiPen could look like. What you're going to do for the first step is locate the outer mid-thigh between the knee and the hip, and you're going to watch for the hem of pants, and it's best to try and directly do this onto the skin. So what's going to happen, there's a needle at the end of this EpiPen, and that's going to inject epinephrine into the person. So you want to make sure, or it's even better to make sure that you're directly putting the needle onto the skin so all of the epinephrine is going into the body. So B, remove the safety cap, which is up here. C is push the auto injector until you hear a click against the mid-thigh. So again, you're pushing this end into the thigh. You hold in place for 10 seconds before pulling straight out of the leg. So most EpiPens have this direction kind of panels set on their EpiPen as well, so that someone that doesn't have an EpiPen can administer it for someone else. Looking next to asthma. So asthma is a lung condition that narrows the airways. Symptoms range from mild to severe and can be life-threatening. What to do if someone's having an asthma attack? Get the person to sit up, slightly lean forward. Encourage them to stay calm and breathe slowly. 3. Help them use their inhaler by holding it up to their mouth and pushing down on the dispenser as they deeply inhale. They should hold that breath for 10 seconds. 4. Give a second dose in 30 to 60 seconds if needed. And 5. Call 911 if there is no improvement. So if a person gets better after taking their inhaler, which many people do, you don't have to call 911 for this. But if someone's been having an asthma attack for an extended period of time, 911 is the best decision. Fainting. So this is when a person collapses. Your first step is to check if they're breathing. If they're breathing, you lay them flat on their back and raise their feet above their head. Monitor their breathing, making sure they're continuing to breathe. Check for any injuries if they fell. Do not use smelling salts, slap their face, or splash water on them. You're just going to lay them on their back and then monitor them and make sure that they're doing well if they're breathing. If a person collapses and they're not breathing, that would be a sign to seek medical care. If they fainted multiple times, then you need to call 911. If there's no apparent reason for why they fainted, so apparent reasons would be if they hadn't eaten that day, if they were doing sudden exercise, or different things like that. If they saw blood, some people faint at the sight of blood. If they don't become responsive soon after, so if they aren't responding to you relatively soon after they have fainted, you should call 911. And if the person has diabetes, seizures, is pregnant, loses bowel or bladder control, or is over 50, that would be a sign to seek medical care. Heat stroke. So this is different from heat exhaustion. We have this little diagram on the side here to show the difference between heat exhaustion and heat stroke. We're going to talk about heat stroke though, and this is when an individual's body temperature is too high. They have extremely hot skin, may be wet from sweating, altered mental state, confusion, aggression, disoriented. If they do not have this, they might be suffering from heat exhaustion and should be removed from heat and cooled down. So altered mental state is a super important one in understanding if it's heat stroke or heat exhaustion. So if you find someone suffering from heat stroke, what you should do, number 1, call 911 as soon as possible. 2, take the person to a cool and shaded area. 3, remove clothing down to the person's underwear. 4, cool the person as quickly as possible by any means necessary. So dump water on them, just get them cooled down however you can. 5, when their mental state improves, stop cooling as aggressively. So again, the disoriented, confusion, or aggression, altered mental state is what classifies something as heat stroke and not just heat exhaustion. On the other end of the spectrum, we have hypothermia. So this is when the body's temperature drops more than 2 degrees. You could tell someone's hypothermic because they have uncontrollable shivering. They get the umbles, which is grumbles, tumbles, fumbles, stumbles. So if a person is kind of like muttering to themselves, they're falling, they're kind of stumbling around, they can't move their fingers very well, that would be the umbles. They have cold skin on the chest / abdomen or back. So typically the chest and abdomen don't get cold and your back doesn't get cold. If those are getting cold to the touch, that means they could have hypothermia. So what you should do is 1, get the person out of the cold, 2, replace any wet clothing with dry clothing, 3, wrap the person in insulation, so blankets, and then a vapor barrier, so something like a garbage bag or tarp to prevent heat loss. So again, you're wrapping them in blankets first, and then some sort of a vapor barrier, like a garbage bag or a tarp, to prevent heat loss. Do not put them in warm water. This is because it's hard to tell how their skin will react and how damaged a person that is experiencing hypothermia, it's hard to tell how damaged they are, and they might not be able to tell you if the water is too hot for their skin to handle. Number 5, if they do not recover, you need to call 911. If they're not recovering or have extreme hypothermia, call 911. So tick bites, one other thing that we could experience here in Manitoba. Most tick bites are harmless, but some have disease like Lyme or Rocky Mountain fever. So what you should do if someone gets a tick bite: 1, use tweezers to pinch the tick at the head, part closest to the skin, and pull upward with steady, even pressure. Lift the tick until the skin is tented and hold until the tick lets go. 3, do not grab the tick by its body. The tick could internally explode and its contents squeezed into the person. 4, when the tick is removed, place it in a plastic bag and bring it to the doctor within 72 hours to identify the type of tick and any possible preventative actions. 5, if you develop a rash or fever, go to the doctor with or without the tick. So it's good to know that you should actually take the tick to the doctor to make sure that it's not a tick that could be carrying some sort of disease. Bleeding wounds. So if someone you find has a bleeding wound, first step is to make sure that you're wearing gloves. You want to make sure that you're not coming into contact with somebody else's bodily fluids. Second, you cover the wound with sterile gauze or dressing. Third, you apply direct pressure to the wound. 4, if bleeding does not stop in 10 minutes or they bleed through the gauze, do not remove the current gauze. Just add more gauze to the old ones. 5, apply a tight bandage over the wound. And 6, if bleeding has not stopped, call 911. So number 3 here is really, really important. Apply direct pressure to the wound. You have to put a lot of pressure. It helps with clotting. Put pressure on any wound for as long as possible. Even after a tight bandage has been applied, keep applying pressure. Bone, joint, and muscle injuries. You should remember the acronym RICE. So R stands for rest, do not move or use the body part. I stands for ice, apply cold for 20 minutes every 2 to 3 hours. Wrap the ice in a cloth so it's not in direct contact with the skin. After injuring a body part, we don't want to make it worse by freezing that part of the skin, so always wrap the ice in a cloth. C, compression. Apply an elastic or tensor bandage when not icing. And E is to elevate. Keep the injured part raised higher than the heart. So you're always trying to remember this acronym if someone has a bone, joint, or muscle injury. So you know what? That's where we're going to end for today. So we'll end off on our RICE acronym, and later we will continue on with CPR and AEDs.